Well, the end of the national COVID-19 national emergencies could mean more costs for you. President Biden says he'll officially end a pair of emergencies on May 11th.
Up to now, you've been able to get free COVID-19 tests, treatments, and vaccines. Jason Calvi joins us in studio with what you and your wallet need to know.
Well, Ben, if you have insurance, vaccinations should still be free. But UW Health's Dr. Jeff Pothoff tells me to watch out for out-of-network costs. He says it's those without insurance, really, who may have to shell up to $130 for each vaccine dose. Now, the health emergency also led to an explosion of telehealth. It's one of the open questions if private insurers will keep it going after the emergency. Another change coming May 11th. The Centers for Medicare and Medicaid Services had been giving hospitals more money for COVID patients. The U.S. House voted tonight to end the emergency right away, but it won't become law as the president countered that timeline would create chaos. Instead, he's giving the country 100 days to wind down the emergencies.
And we didn't have to worry so much about the messaging with regards to, will it be free or not free? Now that messaging has to get a little bit more nuanced because we don't want to potentially offer services to individuals who are under the assumption that it's still free when maybe their insurer isn't going to cover it.
And as for student loans, federal borrowers haven't had to make their payments. Insurance hasn't been added since this pandemic. So for 3 years, those payments have been on hold.
Right.
So, do you have a date for that? Like, when can people expect, okay, yeah, we got to get going on the student loan again?
Well, that's a key question right now. It's actually the Supreme Court's going to hear it next month or this month, February. They're going to be hearing a case on that. So they should be making a decision sometime in June. The Biden administration has put those payments on hold through that whole process through June. Right now, they're not expecting any payments on those federal loans. No interest will be added on those federal loans, even after this emergency ends on May 11th.
But still, I'm hearing a lot of question marks. We don't know what private insurers will do. We're still up in the air on student loans in some ways.
Yeah. And that's what the president said, and the administration's been saying about why they needed 90 or 100 days to postpone this emergency or to keep the emergency in place for another 100 days, because they said it's going to take a lot of discussions to figure out what's going to happen with hospital billing and telehealth and all these other things that's going through the works right now.
Yeah. Well, thank you for the update, Jason. I know, keep an eye on it. Appreciate it.
Good to have you here in studio.
Yeah.